Ever been completely hooked by a story? Where your brain just kind of locks in.
Oh, absolutely.
Well, today we're digging into exactly why that happened.
Yeah, we're taking a really close look at the science behind storytelling, but also its real-world power.
Right.
The goal really is to understand what makes a story grab us, and maybe more importantly, how we can use that knowledge to tackle some big community issues.
Okay. And we've got some pretty interesting stuff to explore today. First, we'll unpack some of the science, looking at how stories actually affect our brains.
hmm We've got some insights there from uh, exploring the science of storytelling.
Then we'll see how these ideas get applied, practically speaking,
Yeah,
using materials from the Iowa Department of Health and Human Services on prevention efforts.
yeah, really concrete examples there.
And finally, we'll look at a CDC video transcript, We Can Prevent ACEs, which highlights how communities themselves can drive change through, well, often through sharing stories.
So our mission, if you like, for this deep dive is pretty straightforward. Figure out the key ingredients of a story that works and see how this amazing tool can foster positive change right where we live.
Okay, let's start with the science then. Why do stories hold our attention so well? One source mentioned how storytelling unlocks our capacity for sustained attention.
It really does. It's fascinating what happens neurologically. Stories seem to activate our brains much more broadly than, say, just getting a list of facts.
More than just bullet points.
Way more.
Hmm.
One piece mentions stories affect us biologically, psychologically, and neurologically. So think about it like this. Data might flip one or two switches in your brain,
Okay.
but a good story, it lights up the whole darn control panel, engages emotions, memories, even sensory areas.
That makes perfect sense. And we saw that comparison, right? Storytelling versus just factual reporting.
Exactly. The brain activity scans are really telling. A compelling narrative creates this rich network of connections.
Like a web.
Yeah. Whereas the facts alone show, well, a much more limited response. It's almost like the difference between, I don't know, reading a manual versus being immersed in the experience itself.
Right. And one of the slides put it really simply, great stories build relationships and make people care.
That's a huge takeaway because it's not just about knowing something intellectually, is it?
No.
People need to feel a connection. They need to see why it matters to them.
Right.
And that emotional bridge a story builds, that's often the thing that sparks actual action.
Okay, so stories have this pull, this kind of magnetic quality. What are the essential bits? What makes a story really stick?
Well, across the different sources we looked at, four key things kept popping up.
Consistency is good. What's the first one?
Relatability, super important. For a story to connect, you need to see a bit of yourself or someone you know in it.
Mm-hmm.
The Iowa HHS stuff points to this. The general storytelling slides too, and that CDC video,
Mm-hmm.
the narrator sharing their own background,
Hmm.
that's relatability in action. It's that feeling of, oh, I get that, or that sounds like my neighbor.
Yeah, that human connection. Okay, element number 2.
Surprise or novelty. Our brains are kind of wired to notice what's new or unexpected.
I pay attention to the change.
Exactly. A little twist, something you didn't see coming. It grabs your attention again. It makes you lean in and wonder, okay, what happens next? Both the Iowa materials and the slides really hit on this.
Like a hook. Makes sense. You can relate, but if it's totally predictable.
You might tune out.
Yeah.
The third element is emotion or tension.
Ah, the feelings.
Yep. Stories that tap into emotions. Joy, sadness, hope, even fear. They just stick with us much longer. And that emotional investment is what makes us genuinely care about the outcome.
And the last piece, what's number 4?
Simplicity
Mm.
or fluency. Even complex issues can be told in a way that's easy to follow.
Keep it clear.
Right. A clear narrative lets the core message shine through. You don't want people getting lost in complicated details or confusing structure. Make it accessible.
Relatability, surprise, emotion, simplicity. Got it.
Okay, so we have the why and the what. Let's look at the how. How is this actually being used?
This is where the Iowa HHS examples are really interesting. They show how combining storytelling with data can be super powerful for community prevention.
So not just numbers, not just stories, but both together.
Exactly. They talk about using this combo to build understanding of an issue, but also confidence that solutions can actually work.
I remember seeing that image, the open book, with those four elements kind of radiating out.
Yeah, relatability, novelty, emotion, simplicity. That's a nice visual, isn't it? Shows how they all weave together.
So let's walk through one. Youth alcohol use in a rural high school. The data showed underage drinking dropped significantly, like from 28% down to 16% after they ran a peer-led program.
Which is great data, but just saying 16% doesn't quite capture it, does it?
Not really. So the prompts they suggest encourage stories around that data. What challenges do teens face in that specific rural area? Tell us about a student leader who made a difference. How did the community step up with alternatives?
Okay. So you flesh out the statistic.
Precisely. You add the human dimension. It helps people understand the why behind the number and believe that, yeah, these peer programs can actually work.
And this pattern shows up again and again in their examples. Opioid misuse in a farming community.
The prompts there focus on maybe a farmer's personal story of struggle and recovery, highlighting how local pharmacies or law enforcement played a part. It makes the 10% drop in hospitalizations feel real.
Same for vaping in a suburban school.
Yeah, the 25% reduction means more when you hear about a student going from vaping to advocating against it, or you learn about their, creative TikTok campaign.
Right. Or the naloxone example, 5 lives saved. That number is powerful, but the story of maybe a hesitant store owner becoming a champion for it?
Or someone whose life was directly saved. That adds a whole other layer. It makes the data resonate. Same with the underage alcohol compliance checks, hearing from a business owner who changed their ways.
Or even preventing underage drinking in wine country, balancing business with protecting kids. The story of a winery owner changing policies.
Or a parent's perspective. It grounds the data in 18% drop in real-world experience and choices.
It really hammers home that idea. Data gives you the proof, the evidence.
But the story gives you the connection, the empathy. It builds support.
Which leads us nicely into the CDC video about preventing ACE's adverse childhood experiences. The narrator starts with their own story.
Yeah, immediately draws you in, talking about growing up in a tough environment, high unemployment, lack of resources, being at risk for ACEs themselves.
It makes the whole concept of ACEs feel less like a statistic and much more human. You feel it.
Totally. And what's powerful is how they don't just focus on the challenges, but on the incredible people and the community efforts that help them, beat the odds.
By the protective factors.
Exactly. And they give concrete examples. It wasn't just vague community support. It was Mr. Martino, the neighbor who mentored them and helped their dad find work.
Wow. Specific people.
Specific actions. Career workshops from local businesses, their mom getting a work-from-home job, a clinic offering parenting classes with free childcare, a summer camp that was affordable and taught life skills.
Even a specific school counselor, Miss Greer, who connected kids with activities.
Each one is a little story illustrating a prevention strategy.
And they link directly to those 5 key strategies the CDC promotes, don't they? Strengthening economic support.
Changing social norms.
Quality early care and education.
Enhancing parenting skills.
And intervening to lessen harm. It all comes alive through that one person's narrative.
Absolutely. It just underlines how vital those safe, stable, nurturing relationships and environments are. And connecting back to our 4 elements, that personal story is incredibly relatable. It builds empathy in a way numbers alone just can't.
So wrapping up this deep dive, the big takeaway feels pretty clear. There's this really powerful synergy between hard data and human stories.
Definitely. Especially when you're trying to create change in a community, data provides the what, the facts, the evidence.
But storytelling provides the so what.
Exactly. The human connection, the emotional core that makes the facts matter and inspires people to get involved, and remembering those 4 elements, relatability, novelty, emotion, simplicity, that's key to crafting stories that truly land.
It really makes you think, doesn't it? About how you could use stories in your own life, maybe explaining something complicated or just connecting with someone or even sparking some action in your own neighborhood.
It does, and it brings to mind that powerful proverb, sometimes attributed to Native American traditions, those who tell the stories rule the world. So a final thought for you to maybe mull over, what kinds of stories are you telling? And through those stories, what kind of world are you helping to shape?